So I'm Eileen San Juan. As you know, thank you for that lovely introduction, Linda. Thank you for having us here. I'm from Mount Sinai, the HTC there, and go ahead.
I'm Ken Nichols. I'm a PTA, a physical therapist assistant with Maine Healthcare at Home, the Coastal Division. So I do home health, physical therapy in Mid-Coast, Maine, right on the coast. It's beautiful.
Mm-hmm.
Next slide. So in this session, we're just going to go over some examples of safe exercising, conditioning for your muscles and joints to facilitate mobility, extensibility. What I mean by that is lengthening. I try not to use too much of the word stretching, only because, you know, if we're not stretching correctly, which we'll try to go over today how to do it correctly, we could actually do more damage than good. And then also we're going to go over some strengthening exercises, very, very basic, very general, that we all could work on to work on decreasing the risk of pain or injury. Next slide. Just a quick disclaimer. Whatever we do tonight, it doesn't take the place, and tomorrow, it doesn't take the place of like a proper medical diagnosis or medical care. Any treatment plan or advice should be had by your primary doctor or a treatment center if you already go to one, or other specialists. So just if you want to start this regimen and you think of every single thing that we do tonight and tomorrow, and you want to really get into an active, continuous regimen, please consult your doctor, especially if you've had any issues with recent bleeding or bruising, or any conditions that might exclude you from being able to do some of the activities. Next slide. And then if you, and I know there's some younger people that are with us today, if you have right now obviously an active bleed, or for any reason you don't feel comfortable doing the exercises that we're doing, or there's one that's just too difficult for you, or you don't have that motion, the range of motion to do it, please refrain from participating. It's good to, it's good knowledge to know, especially if, if you happen to have an injury now but you want to work on it later. It's something that you can go over with your doctor, your physical therapist later on. So participation in it from home, even from home, is totally voluntary. Okay. Just quick disclosure, I don't know if I told you this, but I actually started business, and it is holistic. It is working on, outside the toolbox type stuff, manual and Reiki, and I am doing some physical therapy. That being said, I do not actually treat any of our patients with red blood conditions there. They're always treated at Mount Sinai. Okay. I've worked with St. Michael's Medical Center in Newark with their BRI before. I've been on the physical therapy task force for our region, and on the NHF working group. Currently, my local job when I'm not in clinic, when I'm not in rare blood clinic, is Genesis Rehab, which I work in the assisted living setting. And thankfully, I've done some talks for HANY in the past, and because of them, HFA, NHF, the chapter in New York, and also I have written an article for Walgreens and done an exercise class for Baxter people.
And again, my name is Ken Nichols. I work currently at Maine Healthcare at Home. The home base is in Saco Bay, but I work in Mid-Coast, Maine. I worked at Sheepscot Bay Physical Therapy, an outpatient clinic that was subcontracted to the Maine State Prison in Warren. So we go in and treat all the inmates for orthopedic and a variety of other things, sports injuries. Was at Central Maine Medical Center in Lewiston, Maine, their acute rehab. Did some pediatric work at the school district in Waterville, and also at orthopedics, physical therapy, and sports medicine at Brunswick, Maine. I've also volunteered at the Patrick Dempsey Foundation for the Dempsey Challenge for Cancer Research.
Next slide. Okay, so here's a quiz for, and I think you can actually answer in the chat box, I guess, if you wish to. So here's our quiz. Let me try to move our. So our first question, afibrinogenemia is a condition in which A, the blood does not clot normally, B, an individual with the condition can be susceptible to severe bleeding episodes, C, an individual with the condition can be susceptible to unstable clots, or is that just A and B, or is it all of the above? Yes, and so the answer, yes, is correct. Everyone was correct. It's all of the above. And obviously, although it is a condition of bleeding, you know, as Dr. Hajazen said earlier, it can lead to unstable clots because of the lack of the lack of fibrinogen.
Okay, I'm going to go ahead and just close it down because it's. Let's go on to the next one.
Okay. And the next one, sorry, I'm just like blocking my screen, but so okay. In general, an individual should go ahead. You can read it.
Oh, I can't read it.
Perform an exercise aggressively until the individual feels pain in the muscles or joints. In general, okay. True or false? Obviously, it's false. Right? We don't want to do any exercise. We're going to try to as best we can. Thank you for answering on the chat. Anyone who answered, but we don't, in general, want to go so aggressively until we feel pain. Okay, pain is basically our gauge in order to know that we're doing something wrong. But that being said, even we talked about trauma and, like bleeding from trauma, bleeding from injury, bleeding from post-surgical issues. So perhaps when you start to do a therapy regimen, it might be painful, but you don't want to do it so consistently that you keep increasing that pain. Okay, keep reproducing that pain. So that is false. Okay, last one. All right, and we'll go over this too. An activity should be stopped immediately, and the physician and treatment center should be informed if the following occurs: vomiting, dizziness, headaches, seizures, pain or swelling in the joint or muscles which suddenly limit movement and continue to hurt at rest. And let's see, F is all of the above. And I just wanted to, if anybody wants to just chime in on the chat, if anyone just wants to chime in on the chat as well, A, B, C, D, and E. I'm sorry, A, B, C, and D. What might that tell us if somebody's having those symptoms? Especially with this particular condition. Anybody want to take a stab in the chat? Yes. And where specifically? Thank you for that. Yes. Intracranial bleeding in the head. And then what about pain or swelling in the joint or muscles which suddenly limits movement, and then it continues to hurt at rest? You're not doing the exercise anymore, but say you might have a pain in the calf, or you tightened your bicep so much you started getting a cramp there, but okay, it's a cramp, and after the soreness is gone, it's still there. What could that be? Yes, bleed in the joint, and then anything else that it might be? So it could be also a sign of a clot. And sometimes we don't always know that, okay? But if you do have just that localized pain or swelling in the joint or the muscle, you're suddenly limited by movement, it hurts like basically anything you do. Definitely, if you're going to therapy or you're in a sport, definitely let your provider or your coach or somebody know, and it should be something that you should tell your doctor or your treatment center. Okay, next slide.
Those who think they have no time for exercise will sooner or later find time for illness. Edward Stanley.
Yep.
Yeah. So that basically means, make time for exercise, getting moving, it increases circulation, makes you feel good. Just to try to limit any kind of illness, especially in these times, when we're not getting outside as much.
Thank you.
Yeah.
Thanks. And earlier we talked about hemarthropathy, right? So one of the worst things that you can do with an arthritic joint is just to stop movement altogether. Again, as long as it's indicated by your doctor to be able to do so. We really should keep that joint mobile. We should keep those muscles moving, and as long as we're doing it the correct way. All right, next slide. I'm just going to move us over a moment so you can read it. Why do we exercise? I'll just go.
Healthy weight. That's one reason for exercising. As we exercise, we with maintaining a healthy weight, improvement in muscle integrity. So that just means that as you get stronger, it keeps those joints nice and tight. Uh-oh. Are we still there?
Can you hear us? Okay, good.
Yeah, so it just improves the physical function, keeps those muscles stronger, and keeps those joints more compact and the tighter, than being able to move better. Improves mental health and reduces, improves mental health and reduces risk of dementia and Alzheimer's disease. With that, it increases circulation with exercise, so it helps, kind of clean everything out and keep things moving, and supplies the brain with oxygen, supplies the brain with the cells with all the food that they need, and all the everything they need to function properly. Reduce chronic disease risk of cardiovascular disease and cancer, and the same thing. The more we move, the better our cardiovascular system gets. It's kind of you move it or lose it, so to speak. So when we sit too long, it just kind of, you lose all that endurance that you have, and you can't increase your chances of cardiovascular disease or cancer. So by moving, it just gets all that going. And decreases risk of pain and injury. Again, it goes back to that second bullet point of getting stronger, moving, and keeping your joints more compacted with those muscle strengthenings. Also with that, the extensibility part and the motion, it prevents injury, to the muscle, to the joint, and, everything else.
And going back to that one point, especially during these times right now, talking about improving mental health, and the research does show that as you exercise, especially when you keep yourself moving and it's a consistent thing that you do about 30 minutes a day, you decrease the risk of like vascular dementia, decreased risk of depression, and especially in these times when we're a little bit more holed up at home and we're not able to do a lot of those things outdoors, it's really important. Next slide. Okay. Some of our concerns, and we talked about it when we did the little the quiz, was for PT. Okay, so if you are referred to go to physical therapy, outpatient physical therapy, some of the things we're going to look at is any bruising you might have. So any area that tends to possibly bleed more, or you tend to injure more, we're going to look at that. Joint swelling, sometimes your physical therapist, that's actually, I just saw your chat box, so how often should we move? We're gonna talk about that actually later, because I'm going to go over some of the postural exercises, and then we can go over what you need to do when you are sitting at home at the desk all day, Zooming like we are now. So, but these are the things that we look at, in terms of physical therapy is your history of bleeding, where have you been bleeding? Which muscle groups were involved? Which joints were involved? Have you had arthritic changes because of the degenerative nature of recurrent bleeds to the joint? Or do you have inflammation at the synovium? You know, do you have synovitis? Those are things we look at. And like I said, the risk of these formation of these clots that are not stable, that can easily move. So if you're going to therapy, or you're you know, having, you know, active in a sport, and you have an idea that there's an area that is painful, is swollen, any symptoms that seem abnormal in a muscle or a joint, you definitely inform your doctor, because it could be a clot that's not stable. And if it does move, it could actually block, you know, particular blood vessels, or even worse, could cause more severe life-threatening issues. Next slide, please. This is me, hiding from exercise. I'm in the fitness protection program. We don't want to become this, all right? You know, I know in the beginning of the pandemic, we kind of all were like this. We had some time off. We could just, but we don't want to continue to be like this, especially if we do have an issue with a blood condition. We want to make sure that we keep moving. We want to make sure that we're keeping the integrity of those joints and those muscles as safe and healthy as possible. Next slide, please.
So let's reduce the risk of injury. It hurts when I pull my hamstring. Yeah, so, you know, part of not moving is those muscles just get kind of, you know, tight and unused. And it's kind of like when you wake up in the morning and you have a little soreness here and there. That's part of it. So, you know, reducing the risk of injuries means getting up and moving. The saying goes, motion is lotion. So, you know, get up and move a little bit. It makes everything feel a little better. It can relieve some pain and reduce the risk of injury.
Next slide, please. So we, like I said, we talked about stretching, and you won't hear a lot of physical therapists within the treatment centers talk about, we do teach it, but we don't talk a lot about stretching, because it's very easy when we go to stretch. We think of like those crazy yoga stretches, and, you know, I'm bent in half, and but it's very easy to overstretch, and it's very easy to have micro tears. We do micro tears, so just FYI, we do micro tear in our muscles, and that's how we build some, you know, that's how we build muscle mass. But in this regard, we just have to be very, very careful how we do it within the community, okay? Because we want to make sure that we're not overstretching. Stretching, gentle stretching, it improves the quality and ease of motion. It feels good. We improve extensibility, or the lengthening of you know, the lengthening of the muscles. So we actually add more motion, perhaps, if it is possible to. We normally teach in clinic a 30-second stretch, and 3 even to 5 repetitions. But and, you know, we could give you the research on that, but in the general population shows that at least even just 3 repetitions of a 30-second stretch 1 time daily, and we try to do it 2 or 3 times, gains that extensibility of your muscle and improves your range of motion. We try to do the stretches, if it's possible, to do range of motion exercises on both sides, so that we balance and we decrease the risk for soreness. And we just want it to be a gentle pull and not painful. Okay. Use pain as your gauge. Next slide.
So strengthening activities. So we have these resistance bands that you all should have gotten in your kit. They're all resistant by color. So the targeted muscle has to adapt to the changing resistance. So resistance starts at 0 when there's no stretch. It increases as you stretch it to the maximum stretch to pull it out. So the muscle has to adapt to that. So it's kind of like a bell curve. You start off with 0 pounds and move up to, I think this one is 3 or 4 pounds of the maximum stretch. So your muscle just has to adapt to it, so you get maximum strengthening with that. That being said, again, you know, go off of what Eileen was saying, is we don't want to have any pain with any of these in the joint or in the muscle. So, and that goes to the next point, is low load, high reps for joint protection and strengthening. So you don't have to go and, bench press your maximum, that you can. If you just do a low load, meaning, light weights, but you go for more repetitions, that's going to build the muscle and enable that joint protection while strengthening.
And the bands are easy to use. You can carry it in your pocket. Look how small it was in, the little plastic bag it was in, and there's even a carrying case, which is great. It's lightweight. You can keep it at your bedside or your chair. You put it in your purse when you get a chance, like when you're back to work. Normally, you could, just keep it under your desk and actually do stretches. Then we're actually going to show you a lot of stretches that are, a lot of exercises that are seated, okay? And it's safe that way, and also it's very easy to do. And you can always do it while, watching TV as well. Next slide. Okay, here's the good part. Is everyone ready to actually do the exercises? It's so hard. It's so hard Zooming because it's like, we won't get the answer, but listen, if you want to try, please, yes, okay. Yeah, oh yeah, all right, okay, Linda. But we'll definitely, let's try some of these exercises. These are actual exercises that I also, you do it in outpatient or you do it in the homes of the patient, the patient. But these are general exercises that basically anybody can do as long as, one, it doesn't give you pain, your doctor, your physical therapist, if you go to a treatment center, has not contraindicated it for you. But again, like I said, all of these exercises are very general. So for you specifically, if you've had issues with any joints or muscles that we're working on, definitely contact your doctor first if you're going to do a regular regimen, okay? The first one we're gonna do, what's the gastrocnemius and soleus muscles? The gastrocnemius is, I'm gonna try to do this. Look how good I did. All right, the gastrocnemius is the, if you think of your, oops, Jessica? Oh, I don't know what happened.
I stopped sharing so that they'd be able to see you guys better.
Ah, okay, thank you. Oh, okay. So if you actually look at the calf, I'm gonna try not to fall down. So if you actually look at the calf, that rounded area, okay, the muscle that's more on the outside that you can feel is the gastrocnemius. Underneath it is the soleus, okay? The soleus helps us to stay stable when we're standing, right? So it's really important. Oh yeah, definitely. And I can also provide, you guys some more, I could send it over to you and then Tyshawn and Jessica if you need more. And, so basically this is a calf stretch, okay? And we definitely want to do that because a lot of what we see is if you tend to bleed, the first thing that touches the ground is our feet, right? The first thing we do when we go to walk is what? Land on our toe, we push off of our toes, and we're activating that, your calf muscles. So it's an area that tends to get beat up a lot. It's an area that can tend to bleed. And so we want to make sure we're stretching it out. Okay, ready?
Do you want to show? Or do you want to?
Yeah, so the seated, can I see the, oops, did I lose you? Jess?
Yes.
Can I see, do you mind if I see the slide again?
Sure.
We're going to do the seat. Okay, first exercise, everyone.
Okay, hold on.
Just want to make sure.
There we go.
Okay, so the seated calf stretch.
Yeah,
I'm gonna put my leg up here. Can everybody see it? I think I can, so I just want to make sure everyone can too. You can also be seated and then put your leg up on a stool. Correct. Right? Yeah. Or even hold it up, but just in case if you have any issues with your hip or your knee and it bothers you, then you might want to just, if you're in bed or if you're on the couch, you might want to just turn and keep it supported. Take this band, it's actually a yoga band, but it has a nice loop, so you can loop it around your foot. And if you watch my foot, I'm just pointing my toes toward me. You want your arms to do the work and not your foot, okay? Because we're trying to stretch. We're trying to stretch it passively, okay?
So if you relax your ankle, relax the back of your calf, and just pull, and just do a gentle stretch. It doesn't have to be really firm or hard. It's just as long as you feel a little bit of a pull.
A standing calf stretch. Yeah. So Ken's going to show us.
So keeping the back knee straight and your foot pointed forward. Oh, perfect.
Thank you.
Yeah.
Yep.
You want to keep your heel on the ground and then your hand on a wall for support. You can't see that part of me, but you can picture it. And then just kind of lean into it slowly and gently until you feel that gentle pull on the back of your calf.
Right here.
Yeah. So this is a gastrocnemius stretch. To get to the soleus, you bend your knee a little bit and do the same thing. You'll feel it deeper and lower because it's attached to the Achilles tendon a little deeper and lower.
If you have any pain at all, or you don't have that much bend in your ankle, you can modify it a little bit, move forward a little bit. You could just move your leg forward.
Correct.
Okay. And if you still don't, normally we would say, try to keep your heel on the ground, but if you can't, you can lift it up just a little bit. Okay. Because even if you don't have that full motion, you can still do this exercise. Okay. If this hurts more, if the pain increases, when you're when you're bearing weight, then, then just like I said, you could modify it just like Ken showed us. Like you could just bring your foot forward. Okay.
Okay.
That same slide.
Okay.
Strengthening.
Okay. So the strengthening exercise. You want?
Sure. So the strengthening exercise, I'll put my foot up here so you can see it, is you're basically going to go with the same thing as the loop. You're going to put it around down here.
Use your green strap.
Use the green strap.
The more stretchy.
The elastic. And all you're going to do is point your toe and come back up. Just like that, really gentle, okay? You want to watch out so you don't move your hands to pull. So you don't want to do that. You want to hold this steady and then just move your foot up and down.
Should I show them also if you turn it this way? And this is a little bit harder because you probably need somebody else to do it, or you could tie it somewhere. So, for example, if you're able to get on the floor and you want to tie it to your bedpost, you can do that as well. So you're just holding it.
And I'm just pulling back and forth. Same motion, just up and down. This is going to strengthen your tibialis anterior and the gastrocnemius.
It takes me 10 minutes.
Yeah.
And do you know what? Anyone, even though we gave you this, if you can't do it with them, you could do this one, especially without anything at all. So Linda, even if it takes you a while, you could just do, I teach people all the time to do even just ankle circles, okay, up and down, even without the band. And then also, I have people also do, side to side, make the alphabet, with your toes. Then you're encompassing a lot of different motions there.
Yeah. So my leg is up on this bench right here, but you can also do it seated. Have the band around your toe. Just try to see it. Okay. I can't see it, but you can also do it seated, just like a gas pedal on a car, up and down.
Okay. So the question was, how many sets or repetitions should you do? So for the stretch, we had said 30 seconds, 3 times, I say even sometimes 5 times, 1 to 3 times a day, okay, for the stretching. So that was the first one that we did. And the standing, by the wall. For this, do you do your 6-second hold, 5 to 6 second hold?
I just do it by account.
Yeah.
My generation,
So-
my population is a little different.
So I have people count, slowly count to five or six, and then do about 10 to 15 repetitions of it, okay? Again, this is something that you should, if it feels like if it's too much for you, I don't want to give you a treatment plan, but like, it's something that you could talk about with your physician or your physical therapist. But definitely, it's an easy enough exercise that, you could do safely so long as you don't have pain and it's not increasing your discomfort. Okay? Next slide.
Okay.
The knee. The knee, the seated,
Okay.
Okay.
Bad.
Yeah. So your seated hamstring stretch, okay? The hamstring. So if we're talking before about how we're sitting all day long, especially these days we're sitting all day long, and if you're working from home, that's another thing. Our knees are bent. They're usually in that 90-degree position, like all day long. We want to really try to stretch those the hamstrings, which are the muscles that bend your knee, okay? But they're also very, very important muscles. When they're tight, they can actually make you very tight in the low back as well. So it can contribute to low back pain. So this is something that I try to get everyone to stretch. All right, so
You can try to do the side view.
I'll try to.
Yeah. So, side view, you might have to hold it.
Mhm.
So basically what you're gonna do is seated, you're gonna come to the edge of your seat. You're gonna put your heel on the floor with your knee straight. You're gonna pull your toes back as far as you can go comfortably. You wanna have good posture. You wanna put the curve in your lower back, okay? I don't know if you can see that. Yep, so you're up nice and tall, and then you wanna bend forward at the hip, not the back. The purpose isn't to go ahead and touch your toe, because that puts a lot of strain on your low back, and you're not gonna get a good stretch in the leg for that. So what you do is, with your heel down, your knee straight, your toe up, sitting up nice and tall, and you're just gonna lean forward until you feel the stretch in the back of the knee, back of the calf, and then the hamstring itself, all the way back. Hold for a good 30-second count if you can. Start off with a 10-second count, work your way up to a 30 as you progress. And each day you should be a little further and further, but again, no pain with this, just
Stretch 30 seconds, 5 times, 3 times. I usually do 3 to 5 times. And at least once a day. If you can do more, absolutely great. Again, you're going to hear me repeat it over and over. You do not want the pain to keep increasing or the discomfort to keep increasing. Okay. You might be tight and you might feel that pull, but you don't want to feel a continuous burn and an increase like that. Okay. Next slide.
hamstring curl, strengthening.
I'm sorry, stay right there. Long arc quads. Thank you, Jess. Long arc quads. Easy peasy, guys.
So this one is soft.
I think we might be having a technical issue.
We're going to give them a couple of seconds or a couple of minutes to see while Eileen and Ken are getting their technical glitch up. I'm going to recommend everybody stretch. It's good, good exercise. Yeah, let's see if I can reach out to her. The weather's good, so I don't think that's a problem.
Can you hear us?
Okay, you're back.
There we
Can
go.
you see us?
Yes.
Okay.
Listen, you can't miss it. I got this outfit just for today. I look like cherry Italian ice. I was so afraid because we're Zooming that you can't see my limbs. So that's why. All right. Next,
Okay.
so we did the long arc quads, we did the knee. Let's go to
Okay.
next slide.
Hold on one second. Okay.
All right.
The hip. Guys, just FYI, before we start the hip, be very careful with this. We've seen in the past people get what's called iliopsoas, which is a hip flexor bleeds that are very, very difficult to recover from. And why is that? Because it's a very vascular, the hip is a very vascular area. It's full like blood vessels, nerves that are coming from your low back into the legs. So we want to just be very careful with this, although I do want to show you these exercises because they are very, very important. Okay? Yeah, thank you. So can you hear us? Everybody still okay? You can still see us, hear us?
Yep.
Okay, good. All right, so we're going to do next the hip flexor stretch. Okay?
Yep.
Okay.
Unless you want to do
No, go ahead.
it, so we can see the limbs.
Yeah. Oh, my limbs? Okay, show me what to do. All right?
Go ahead.
So the hip flexor stretch. What are your hip flexors? Your hip flexors are the muscles here at the front of the hip, right at the back. And basically what they do is flex your hip. Bring your hip forward so you can take a step, right? We tend to be tight in this area. Why? Because again, we tend to be sitting a lot, especially now. So we want to make sure we're stretching out this area. Ready?
Yes.
Go
Go ahead. Yeah. Do the stretch.
So, all right. So you're gonna see me stretch my left hip flexor. So what does this look like? It basically looks like the same stretch for the calf, right? So it's something that you can do that actually works both. Anything else?
Yep, absolutely. The
Okay.
important part of this is to get that hip behind the other hip so that you feel stretch right on the front of your hip. But again, a gentle stretch. Doesn't have to be anything strong.
Now, right now, I actually have an issue at this hip. So just FYI, I do feel a pull. And then I'm gonna back off a little bit, all right? So you do wanna feel, a little bit of a pull, but you don't wanna feel a burn, okay?
Got it.
Okay,
Sorry.
slide again, please.
Seated marching.
Seated marching.
Yeah, that's just straight.
Seated marching.
Can you see me?
Yep,
So what I just did is I put the band around my knees. You want to keep your knees shoulder width apart. Bring the band together and you're going to hold it with your hand, okay? So the seated marching, what I'm going to do is I'm going to push down a little bit with my hand and just come right up. This strengthens these muscles right here all the way up into the hip, okay? Just like that. If you can't tolerate the band, don't use the band. Just do it without the band. The other way, you can pull up and do the same thing, but now you're pushing down into the band, which is giving your hip extensors, which is, your gluteus, all your glutes and all that. That helps with walking and pushing and walking up hills.
Mm-hmm.
The other hip muscle out here is really important for balance, is the gluteus medius. So that one, what you want to do, yep, right on the side. It's right behind the hip bone, what you think of as the hip bone. So with this one, just come out to the side and back in, just like that. Really gentle, but it really gets that muscle. It's responsible for holding your pelvis level when you stand on one foot. So when you're walking and taking the steps, you're on one foot almost half the time. So that's why that's important.
And like I said, with
Just like that.
any of these strengthening exercises, if you notice that it's a little too hard with the band, and this is a medium resistance band, you can do it without as well. And we already did the seated hip abduction, adduction. That was the opening and opening and closing of the legs. And the next slide, please.
For some reason, it's not sliding. Hold on. Okay. There we go. Try again. Okay.
Okay. The bicep stretch. Okay. But actually, I want you to show the bicep stretch.
Yeah.
Show them on me.
So the bicep stretch, you're gonna straighten your hand. Just bring your hand back really gentle. Now, Eileen is hyper flexible, so she has a little more flexibility than most people do. So you can see her bending backwards a little bit. That's not usual.
Do not try that. You know.
So if she does this on me, go ahead and do it on me. That's a little more normal. Yeah,
So, right. So, and what you might find is some of us, some of us actually might have a contracture if you've had a lot of bleeding in the elbow over time, you might lose some of that motion. So you might not be able to even get to this area. You might only get to here. That's okay. You could still stretch it right at the comfortable motion.
And
okay.
Again, even if your joint is bent like that, as long as you feel that stretch, just a little bit, that you're getting that muscle.
Again, try to differentiate what's a feeling of pull versus pain. Okay, you might feel pain for a moment, but don't keep taking it further and further out, and you don't want the pain to keep increasing. Okay, and standing elbow extension. So we can actually use the band for this.
Sure.
Actually, I'm going to have you go over there.
Yeah.
So what I do with this is I have the band folded in half, okay? What I do is if there's a doorway, I'll actually I'll open the door, clip it on the other side, put it around the doorknob on the other side of the doorway and then close the door on it. So now it's kind of locked in place. Just
make sure if you do that to do it on the side the door doesn't open into, just in case it does open.
Right. And so we actually know that by experience.
Yes, we do.
So what you're going to do is you see it's doubled in half, and you're going to watch my shoulder. Your shoulders, you don't want to be shrugged, okay? Make sure your shoulders are comfortable. Your elbows can start at about 90 degrees and then just pull down.
I'll step away a little bit. This way.
Okay. So you can see. So I'm just pulling down. I'm holding for a slow count of 5 or 6. And then relax. And you're coming down slowly, but don't just bounce back. Okay? Just don't rebound back. So you want to control the motion this way and control the motion coming up.
Control the band.
Control the band.
Control you.
Right. Control the band. Don't let it control it. Control it down. Control it down. Okay? Shoulder finger touch. Want to show them how to do that?
You do it.
Okay. Here, guide me.
What's that?
Guide me with the shoulder finger.
Oh, you go.
Okay. So basically, what we're going to do this one.
I was thinking about this one.
This way. Okay.
Yeah.
So if this is difficult, again, don't do, but it's actually it helps with the rotation of your shoulder. Okay. But if it's painful, if you do not have that motion, let's you know, you can nix this one and we can try something different. But basically, you're going to bring the one arm back, if we can. This arm this way.
Go ahead and turn
Mhm.
so they can see. Just like that. It's a good stretch for all of the shoulder, the whole shoulder complex. It's also important to do both ways. So to reverse it and have this arm go up and this arm go down, just to get all those muscles stretched. Just so I can show you too, I'll go ahead and do it. So this is as far as I can get. I can't get that far on that side just because my shoulders are very tight. And then this side is even worse.
Another way to do it is, just so that you have some guidance, you can also use your strap. And you have loops, so you can put your hand in the loop. Okay. And just go to your comfortable level. Okay. The same thing with the other side.
Yeah, and again, start off with 10 seconds or what you can tolerate and work your way up to 30 seconds if possible. This is a tough one to do on though.
Mm-hmm. But it's really good for in terms of rotation, okay? Our shoulder tends to be an unstable joint to begin with. Why? It has to be unstable because it has so much motion. Up, down, side, rotation, rotation. So basically, we want to protect it, okay? But we also don't want to lose that motion. You know, again, what have we been doing a lot? We're sitting at home, we're watching TV games, and we're basically in the same position. Our shoulders are not really moving, right? So we want to just keep them moving. Okay. Can you still hear me? It's telling me that my internet's unstable again. We're there? Okay, good.
Posture.
Okay, posture. We had a question about, right earlier about what to do at, sitting at the desk all day long. So definitely posture is a big deal. It's something that we try to teach. I know you teach all your patients at home.
Yes.
I try as best I can, even in the treatment center, even though we're not talking about areas that normally bleed, okay? We still want to make sure we maintain good posture. Why? One is that if you tend to be forward shoulder, forward head, over time, it puts a lot of strain on your neck, your back. And in this position, if you go to try to move your arm, if you try it right now, just really slouch forward and try to move your arm, you really can't do it, or it's painful. So you want to be in that, in that good aligned position. What is alignment? Okay, there's a very easy way for you to actually figure out if you're aligned or not. If you can have somebody look at you from the side, okay? So basically, I'm going to try to do it, and you can tell me.
You can look at me there and tell me. Okay.
So, so you can look at somebody and see, is one side higher than the other? All right. Are their arms able to just kind of lay next to their body? All right.
Right. So my normal stance, I do have a little bit of a slouch, and my hands come forward. One quick and easy way I can just fix that posture is just to bring my thumbs forward. Just by doing that, it brings my shoulders up and my head back.
It opens this area as well, your pecs. It helps you breathe better, okay? You can take a nice, slow, deep breath just by, opening that area up. And whether you're sitting, you're standing, especially if you're sitting all day, just try to do even just that correction right there, okay? Bringing your shoulders back instead of forward. What I was also going to say is, can you turn to the side so you can see you? So what we want to look, what I try to look at very quickly in terms of alignment, and this is even in clinic, is the whole of your ear above the axis of your shoulder, the middle of your shoulder?
Yes.
No. No. Okay. So the whole of our ear should be over the middle of our shoulder, should be over the middle of our hip. Okay. That's kind of over it, yeah, but your head is forward. And then if we were to draw a line from your hip all the way from the middle of your hip all the way down to your ankle, your hip should line up with your ankle and kind of cross a little bit behind the knee, okay? If you are not in that position, look at how far my ear is, in front of my shoulder. You want to try to correct that, okay? Ear over the shoulder, shoulder over the hip, and then straight down over the ankle, crossing behind the hip.
So if you
Right.
think about driving too, when you're seated in the driver's or even the passenger seat, your head should be pretty close to that headrest. So it's one way to gauge, how your posture is while you're seated, especially in a car because we're all driving places. How far away is that head? And it may feel a little uncomfortable to get into the proper position. I know it did for me just then, just because my body isn't used to it and I'm not stretched at the right places.
And, and in terms of the next thing on there, you don't have to put it on, Jessica, was ergonomics, okay? Ergonomics and posture. What does ergonomics mean? So you'll hear that often in the workplace. Do you have good body, body alignment, is your desk ergonomically sound? What does that mean, okay? So if you're sitting in a computer all day long, like a lot of us are, even as therapists, we're doing all our documentation in front of a laptop now or an iPad. You should be seated. I'm going to see if I can do this. You should be seated. Can you move the laptop? So you should be seated with your knees at 90 degrees, okay? Your knees at 90 degrees. Now, so when you're seated, whether it's at your desk or anywhere, your feet should actually be, if your hips and your knees are at 90, your feet should be touching the floor. So the best correction here is for me to have maybe a little stool that I put my legs on. It's not really good to dangle because then you start to do what's called sacral sitting. You're kind of doing this, okay? We don't want that. So especially if you're at your computer all day long, hips 90 degrees, knees 90 degrees, okay? Like basically like an L shape, and then feet flat on the floor. Your shoulders, remember, should still be aligned with your hips. Your ears should be over your shoulders, okay? Your laptop. Now the laptop or the desktop, the monitor, and I know this is not going to be possible with the laptop, but the monitor, if you think of the monitor as I know a lot of us are working from home right now, even, doing virtual clinic, Linda, for us, like it's, you could be sitting, you don't even realize you're sitting in that position for an hour, 2 hours, 3 hours, 8 hours, right? You really want to make sure you're in the correct posture. So, if you have your computer monitor in front of you, right? Let's say it's a desktop, which is a little bit easier. You have to think of the monitor as a face, and the eyes of that face. If you were to draw imaginary eyes on your monitor, those eyes should match up with your eyes. If that monitor is down here, that's not matching up with your eyes. You want it right here, okay? How is that possible? All right, how is that possible? So you would probably have to stack it. Where I used to work, when I was working outpatient, and even where I work now, when I do work on a desktop, I put everything on reams of paper or just something stable, With the laptop, it's harder. So what do we do? I would invest, if you work on the laptop all day long, and that's the only thing you could do for work or for school, guys, that, you're still in school, you're great. Your muscles are extensible. You could do this all day long and probably, revert back to normal posture if you needed to, but over time, it's not good. If you get to our age, it's not good. So I would say to you that if you're on the laptop all day long and you're doing virtual learning right now, please, see if you can invest in getting a separate monitor, okay? So you're still working on the keyboard of your desktop, of your laptop, I'm sorry. And again, an additional keyboard made a big difference for you, right? So again, your keyboard should be kind of where at 90 degrees, maybe just a drop higher, but not much more than that. And then plug that in again.
Yeah.
Sorry.
And again, the monitor should be at face level, okay? Why? Because that keeps you as blind as possible. You're not doing this, you're not looking up, at your screen. So please, that's something that's very, very important. I try to, hone in on that even before all of this, and now we are working from home, and now we are doing school from home. So definitely think about that, because it can also, lead to a lot of neck and back pain and then other issues as well. Okay, next.
So as far as postural too, all of those exercises that we did seated, you can do without trunk support. So don't sit back. That actually works on all the core muscles when you do the long arc quad or the seated marches. Yes.
We're almost done. We're almost done.
Yep.
So guys,
Keep
thank you
forward
for
elbow. Right. Yeah.
thank you for staying with us on this. Okay, these are again like I'm big on posture, because your posture is good, your core is good, your arms and legs are going to move much better. You're going to breathe better. You're going you're going to be able to last longer time. So next thing we're going to talk about is scapular retraction. What are your scapula? Okay. They're your chicken wings, your shoulder blades, okay? One thing that happens is if your shoulders are always forward rounded like this, then basically all of these muscles here become very, very weak, okay? To straighten us up, literally, you want to bring the shoulder blades together, okay? But you want to make sure that you're not hiking up your shoulder, okay? So relax your shoulders, shoulder blades together. Try to think of them, pinching them together. Think of, a pencil or a pen that you're trying to hold in place, which I wouldn't be able to do that either. But just try, okay? Hold it there. Again, I try to count to like a slow count of 5 or 6, all right? And then do it 10 times, whatever you can tolerate right now. Okay, I don't want to give you an exact number because everyone's different, and if you haven't been working on these exercises before, like I'm not the best at doing them either, okay? Just do what you can for now and then work your way into making it a regimen, making it an everyday thing if you can. Okay, next one. Wall angel. The wall angel is, I love the wall angel. This is one I always used to show. Oh, and I love that there's a mirror here. You can see it. Okay, what happens when we're forward at our head, at our shoulders, at our low back, we're kind of hunched, right? And you can see me in the mirror, right? Look at my posture. Look how far away from the mirror I am. One of the exercises I try to do to make sure that you're aligned is to try and bring everything back to alignment. What do we do? So against the wall, all right, this is what I want to see. The backs of your shoulders touch the wall. Back of your head touches the wall. Backs of your arms touch the wall. Forearms, back of the hands, okay? And look, there's that space there. There is a normal arch in our back, right? That's normal. But let's see if we can tighten our core muscles and flatten the low back against the wall, all right? Again, like I said, it's great here because you can see it, you can see it against the mirror. Everything flat. Now, as best you can, and if you can't do it initially, you can keep trying. Try to get the rest of your body as close to the wall as you can. Okay, back of the head, back of the shoulders, the arms, the forearms, the back of the hands, the bottom, as best I can, tighten here if you want to tighten your core, and the arch of your back, flatten it against the wall, and then try to get everything else flat. Can we all do that? Probably not. I can't even do it, right? So, and I practice it literally every day. But try as best you can to do that. If anything hurts, if any part of your body hurts when you do that, just readjust and just do what you can, okay? The other thing you can do is just bring your feet a little bit more forward, all right? And then try it again. You can actually get flatter that way. Wall angels, what we mean by wall angels is, y'all done snow angels before, right? Got in the snow, laying down and doing this. So that's a nice progression of this exercise. See if you can bring your arms up, right?
Yes.
And you can even get up here, okay? Behind your back. Don't do anything that one reproduces the pain or increases it, okay? If you have shoulder problems, check with your doctor first. Elbow issues, check with your doctor first, okay? You see, and try to get everything flat against the wall. Okay? What do we have next? Doorway corner stretch. Okay, we're almost at the end. I'm sorry, I know it might be going over. The corner stretch, I guess you'll have to just kind of turn it this way.
Yep.
Okay, you could either do this. You could either do this at the corner of, at any corner in your house, or in the doorway, which I'll try to do if nobody walks in.
It's too wide.
Okay. Okay. I tend to do it up here. Okay. Just basically rest yourself against the wall and fall in. Right? If it's too much of a stretch for your pecs and your elbows and your shoulders, then use your leg to support you. You can even do your lunge for your hip flexors, your lunge for your calf. Can you show them all the way through?
Sorry,
Okay.
I can't see.
Wall push up. Yeah, you can even from here. So this is a stretch, right? But you can from here do the push up as well, right? That's what
And that's the strengthening.
Strengthening. Good job. And that means you do it all the time, right? So basically, and so the stretch, again, hold it for, if you can, 30 seconds, but if you're not normally used to doing that, start at 10 or less than that and try to work your way up. This is a great stretch. If you guys are at the computers all day long, like I said, you are in this position. We are in this position all day long. It's a good way to open the front of your body up. Everything we do is in front of our body, right? Maybe there's just a couple things that we do, like in the back, but everything is in the front of our bodies, so we want to make sure we stretch that out.
Okay.
Do it. You could also do it in doorway.
It's too wide. It's too wide for me.
Same thing, but you're just going in. And then the other adjustment you can make to this is if this is too high for you and it is giving you pain, come down here. And you're even getting a nice bicep stretch from it as well. Okay?
And again, it just needs to be a gentle stretch, not a lot, no pain at all, just a little bit of a pull.
Mm-hmm. And anything, let's see what else we have, Jeff. Okay, and then next slide.
AO extension.
Look at the AO extension is just lifting your head up. Okay. Just because we're always forward. All right, next slide.
For some reason, when I'm in this particular mode, it doesn't like to advance. So give me 1 second. Okay.
That's basically almost it. Oh, sorry.
Okay.
Yes, too much information. I'm glad you recorded this. So, it was very hard. Like I actually tried to find, World Federation had a book, but it was specifically, hemophilia related. I wanted to try and make sure it was active so that you could see us doing it, two different people, two different body types doing it as well. Move on to the next slide, please. Almost at the last slide. You have any questions at all? These are our email addresses, okay? Anything that, sorry, go ahead.
No, I know from my standpoint, and I'm pretty sure from Eileen's standpoint, is we like to educate our patients as well and just do everything we can to get the knowledge base for our patients to understand why they're doing the exercises and how to do them properly. So again, with these email addresses, any questions that you have at all, feel free to email.
Yeah, and we'll try to answer general questions specifically about this presentation. But like I said, if you have any questions about, well, this is my diagnosis, and I'm not able to do this, and this is what I've been encountering in the past. Usually, what I'll do is I'll try to give you a general information, but then really have you go to either a treatment center or like to your primary doctor, to your orthopedist. But as much as I can, without actually giving you a specific treatment plan, definitely we're here to help. Okay, and last slide. Just wanted to thank Hemophilia Association of New York and CSL Behring and Ophthalmology. Thank you guys. Linda, Tyshawn, Jessica, I mean, you've always been great to me, and I hope to help as much as I can. Yeah, it's really important, there's so many things that, we do throughout the day that actually really beat up our bodies. Okay. And if there's any way that we can decrease the risk of, injury, if we can decrease some of the pain that you already have, anything we can do to get you more active. Like I said, you don't want to worsen any arthritis that you may already have. Definitely reach out to your centers as well. If they don't have a physical therapist, they could probably get you in touch with one, or or refer you to one. Okay, thank you guys for everything.
Yes, thank you.
It's been wonderful. Thank you for sitting. Thank you for doing all of this with us.